Did you know that roughly 15% of the workers in the Tampa Bay region are employed somehow, some way in the healthcare field? Today we have a panel of leaders from 3 healthcare organizations that are working to keep Tampa Bay at the forefront in terms of high quality care for patients and also world-class research. Joining us, Steve Mason. He is president and CEO of BayCare Health System. Dr. Paul Danielson is sitting right beside him. He is Director of Pediatric Trauma Services for All Children's Hospital. And Dr. Jonathan Lancaster, President of Moffitt Medical Group. Thank you all for joining us today. Steve Mason, you and I talked the other day about some of the things that BayCare is doing. For people who maybe weren't watching on Monday, I want to talk a bit about the medical records, electronic medical records you have instituted, the online quality report card, and then perhaps most importantly, this whole movement from sick care to well care in terms of hospitals are viewing their mission in the community.
As an organization, BayCare is probably the largest regional organization on the west coast of Florida, 20,000 employees, 273 access points, and 11 hospitals. And we focused, starting about 6 years ago, to put together an electronic record because as you watch what's happening, as healthcare has been evolving, having information in order to understand great outcomes, and now under the new federal program of value-based purchasing, we're matching up cost and outcomes. So we've tried to create a structure that gave us the ability to have a infrastructure that would operate off of that base, and then have created a physician organization called BayCare Physician Partners that will involve about 1,100 physicians in a network. And we're essentially moving our front door from not just the hospital, but to the physician's office, because it's in that clinical space that we'll be able to look at and make better decisions around where patients go when we move to population health care.
So, Dr. Danielson, with All Children's, new facility, a lot of really exciting things happening with your facility. You're in charge of pediatric trauma services. So what's kind of cutting edge about what you're doing in that area?
Well, you're right. We have a brand new institution that just opened in 2010, state-of-the-art children's hospital facility. And just in the last year, we merged with Johns Hopkins University.
Right.
So that's brought a lot of research and educational might to our already busy clinical practice. And that sort of synergy and teamwork is what we're trying to apply to all facets of children's care, not just trauma. But specifically for trauma, we actually partner with one of the adult hospitals next to us. So again, it's a team sport trauma. And we bring not only an electronic medical record, an ability to share electronic images from outside hospitals into our hospital, but then all of the state-of-the-art equipment that's necessary to sustain children who've suffered the worst of trauma, all the way up to putting them to a heart-lung machine if we have to.
You served in Iraq and Afghanistan.
I did.
Did that influence what you're doing? What sort of impact has that made on your career?
Yeah, so if there's ever a silver lining to a war, is that we do learn a lot about healthcare during a war. We learn how to treat patients, we learn new techniques, new scientific developments. And it actually goes both ways. This is one of the first wars where we've applied many of the latest surgical technologies actually on the battlefield. And at the same time, we've taken things like a massive transfusion protocol, which we learned in Iraq and Afghanistan, the best way to transfuse trauma patients. That's been brought back to the civilian sector, and it's brought all the way down to the pediatric patients.
Dr. Lancaster, let's talk a little bit about Moffitt. You're in charge of all the doctors, is that correct?
So I'm the president of the medical group responsible for the physician practice. It's, I think, illustrative of the evolution we're seeing in healthcare, where we're seeing hospitals and physician groups no longer sitting on opposite sides of the table, but becoming integrated in one group that is more closely aligned to enable us to deliver world-class care to patients. We're seeing this across the region very, very clearly at Moffitt, where the Moffitt Medical Group is very closely aligned with the overall hospital goals, delivering personalized cancer care.
And I know that your interest is in women's health care, women's cancer, particularly ovarian cancer, which has been kind of an elusive thing for the medical community to try to figure out how to get a handle on predicting that earlier and finding it before a lot of women are in late stage. So what research is ongoing for ovarian cancer?
So you're right, ovarian cancer is the most lethal gynecologic malignancy. It kills more women than any other cancer, driven in large part by the fact that patients present with advanced stage disease. We're focused very clearly on understanding the underlying biology that drives ovarian cancer, trying to understand the genetics of the cell, trying to understand why a normal ovarian cell becomes an ovarian cancer cell, trying to identify the Achilles heel of that genetic change, and then target it with novel therapies that are directed not just generically at all tumors, but specifically to the Achilles heel of that individual woman's tumor.
And so what specifically do you see coming down the line in the next 5 to 10 years in terms of that goal?
Well, I think we're going to see a continued evolution in how we change the paradigm of treatment, not just in cancer, but in terms of medicine across the globe, moving away from this one-size-fits-all approach whereby we start to identify the genetics, the biology, the molecular determinants of the disease, and start to tailor therapy to the patient on the basis of their individual biology. It may be new drugs, it may be new interventions, it may be new ways to prevent the disease in the first place, moving away from treating everyone as if they're the same to a far more tailored, more individualized, more personalized approach to medicine.
A possible screening test for ovarian cancer?
We'd love if that were the case. To date, efforts to define a pap smear or a mammogram equivalent for ovarian cancer have largely been unsuccessful. We don't have a good tool to define or to identify early stage ovarian cancer. We continue active research, both looking at ways to image the body, whether it's using sonograms or other radiographic imaging, or even blood tests. But to date, we've really not identified the appropriate or optimal screening tool for ovarian cancer, unfortunately.
We just had a fact sheet up about Moffitt Cancer Center. You are from Wales, is that correct?
That is correct.
What drew you here to the Tampa Bay area?
I grew up in Wales and I went to medical school in Wales and I started my residency in Cambridge, but I was lured to the United States to really integrate science with medicine. I didn't just want to be a clinician, I wanted to be a clinician who performed research, molecular research. And Moffitt was really one of the few places in the United States of America, in fact the world, where someone like myself, a physician scientist, can see patients, but also engage in laboratory research where we start to understand the molecular basis to what we're seeing in the clinic, and to direct the knowledge both ways, taking what we learn from patients back to the lab and taking what we learn in the lab back to patients, this true bench-to-bedside concept.
Dr. Danielson, sort of same question to you. Why are you doing what you're doing here in the Tampa Bay area?
Well, I think there's this region is unique because it brings together industry, universities, and entrepreneurs all working together to sort of advance medicine in different stages. So especially in pediatrics and in pediatric surgery more specifically, we're able to take, say, for example, some of the instrumentation for minimally invasive surgery in children. Now we can do operations through a 2mm incision, things like that. That isn't possible in most places, and we're in a community here where if we have an idea for a new instrument or a new technology that we want to develop, a new device for use in children, we have several partners in the community that we can draw in. We have the Hopkins Bioengineering School that we draw in, and we have a collaborative effort, students, industry, entrepreneurs, clinicians, working all together for the same thing. And that's unique to what you find at All Children's and here in Tampa Bay region.
One of the biggest debates in the country going on now, and we certainly don't want to get into the politics of it, but healthcare is a huge debate in our country. And I think everyone says, you know, we need to do something, not exactly sure what it is. So I feel very fortunate to have representatives from 3 different healthcare systems here to kind of give me your sense of where does it need to go? What are the challenges we need to solve with our healthcare system currently? You had an idea back in the green room you're talking about, Steve.
Well, Kathy, I agree with you that debate isn't about politics, but it's about how do we get the cost down? I think all of us are looking at that. We're a very large employer, and I know that many employers are concerned about being able to provide that health care. So the real concept is, how do you create change and reform and do that through a new model. And the model that we think is going to work is the creation of a clinically integrated network that begins to focus through a medical home to provide at a primary care level to provide care to all patients.
Now, what do you mean by medical home, Steve?
Medical home is really taking a team approach to providing care so that the primary care physician can, in his or her daily practice, begin to see those people that need to be seen today, but people with chronic diseases managed with a team of people that physician oversees to make sure that we're keeping diabetics stable, that we're giving them education and the latest kind of information, helping them monitor their care, as well as congestive heart failure patients or kids with asthma, which is a large challenge. And by doing that, we'll be able to keep the cost out, keep hospitalization down, keep people at work and kids in school, in the asthma example. And that begins to reshape how we're using the resources of healthcare in this country. And to me, that's what the concept has to get to. We're perfectly designed to get the results that we're getting today in this fee-for-service world. And you know, Einstein's definition of insanity is keep doing what you're doing over and over and expect a different result. We've got to change the incentive. We've got to create the incentive. And I said earlier, move the front door from the hospital to the physician's office, because it's through the eyes of a clinician that we're really going to be able to make those changes. Now, we have to help provide the support to that physician so that he or she can make decisions to move patients in a very convenient, quality way through a different level of care rather than admitting them in the hospital.
Well, so Paul and Jonathan, Steve says he thinks it's bring down healthcare costs. Do you think that's the challenge also, or would you say there are others? How would you define the challenges of the future going forward?
So yeah, it's a tricky issue because cost, you know, how much do you want to spend on cost? That's going to be a national debate about how much money is going to be put into healthcare. So that's a discussion sort of beyond this table. But what I think we probably all agree on is that prevention and management is probably a more effective use of healthcare dollars than doing sort of what I do, which is super specialized stuff on the high end, or so what Jonathan does too. You know, I think that the system is set up now to incentivize people to do more tests and more procedures and not to manage patients. And so through an integrated system like Steve is discussing, you know, where it's horizontally integrated, vertically integrated, you can manage the patients better. And those that need the super specialized care get it, but the rest of them are managed in a more efficient manner. I agree.
What do you think?
No, I agree completely. I think the question's less about politics and more about sustainability. We have great healthcare currently, but I think the one thing that's sure is that it can't continue. We cannot continue to see healthcare costs rising the way they are. And we spend a lot of money on healthcare in the United States, but we don't necessarily have the best outcomes. And I think we really do need to reevaluate how we deliver care and ensure that we continue to have a healthcare system moving forward and really bringing quality into the picture. Right now, much of reimbursement, much of the service that's provided is driven by fee-for-service, as you've just mentioned. Right. The more we do, the more money that's is brought into a system. We need to change that paradigm to one where we're being reimbursed, we're being compensated for quality of care, for outcomes, for survival, for decreased complications. I think that's the big shift we all hope we'll see in moving forward, irrespective of the politics, irrespective of what happens in November. It's not so much a need as an essential requirement. We can't continue doing it the way we're doing it. The question on the table is really, how do we go about making the changes we need to make?
And I'm optimistic because I think the latest generation of docs coming out understand that this is part of the job.
That's right. Now, you guys, this is a wealth of information. I really appreciate your time very much, Dr. Lancaster, Dr. Danielson, Dr. Mason, representing BayCare, All Children's, and Moffitt. Thank you very much. Good to have you with us today. Coming up next, Frank is going to go one-on-one with Tampa Bay Lightning owner Jeff Vinik.